I've come live because my treatment has commenced. So I did say I will do a live and just explain a little bit what's been going on to this point. I'll let a few people come along first before discussing further stuff. I've got my bronchiectasis t-shirt. I actually sleep with it at night because I don't wear it. So it'd be rude not to use it as my pyjamas or to go live on YouTube from time to time. So yeah, we'll give it a minute or two like we do. We'll see who's coming on, whether it's the old, the new, anyone. Give it time to just grow in momentum, and then we'll talk a little bit, and then I'll get my head to sleep because I've got my therapy tomorrow, day 2, which I think is going to go fast, and I'll tell you why shortly. I've got a new treatment plan, which is it's a change of medication now. So for the last 5 years, I've been on intravenous meropenem 3-month cycles for 5 years. Now there's a battle between microbiology and specialists, as in antibiotic resistance. I think there's a little bit more that meets the eye than just antibiotic resistance, but I'm not going into that. It's my viewpoint. But yeah, so because I've been on one of the best intravenous antibiotics to fight chest conditions such as mine, bronchiectasis, what's happened is they're a bit worried with me only being 38, 39 in September, that they want to keep the best Arsenal back, and I'm not on about the football team. I mean in terms of the best ammunition, which is the meropenem. It's the Ferrari of antibiotics, so to speak. So because I've been on them a very long time, they're just worried if, say for instance, one of my bugs, Pseudomonas or something else, colonises or becomes resistant or needs extra ammo, then where do they go from there? So what happened today, a nurse come on day 1, and I overheard her on the telephone. So I could hear her speaking to one of the nurses high up in the office, and I heard 4 grams Kef. So I'm thinking, that's not meropenem. Ceftazidime, can't say it. But anyway, so when she got off the phone, I said, have they changed my antibiotics? So she said, let me have a look. So they had a look. She said, yeah, it's 4 grams of Kef. We'll call it ceftazidime. Very hard to say. And it's only once a day for the moment. So the only downfall to this, with the meropenem, the nurses would come out 2 times a day, AM to PM, and they'd run the meropenem, which could run between 15 minutes up to 35. With being young, they can run it a little bit faster than they could run an old person who's on intravenous. So with this Kef, they have to run it over an hour because it's a very, very strong drug. So it gets a bit boring, having to just wait there and let the bag do its thing. Sometimes you get a nurse that you can gel with, who's not too intrusive, and time flies, and you get some that do your head in, kind, so to speak. But because it's only once a day, I feel like if this is working, if this is working moving forward, I'm quite happy to stay on it, especially if it's fighting the bugs. It's keeping me well as it can, and I'm not having to see nurses twice a day for 2 weeks at a time. Then so be it. So I've not had any side effects. It's only day 1. I've only had 1 course of this ceftazidime, if that's the way to pronounce it. The only thing I will say about my side effects were, there was a couple. So 1, I felt tired on it. 2, I felt like I needed to go to the toilet, like I needed a wee, and I felt very hungry after the first dose. I had this appetite that I didn't have, but I didn't have the energy to cook. So one of my family members made me a nice tortellini with salsa and pasta. Buon appetito. Hi, Molly Bell. And then I had a bit of Greggs, and then I can't remember. I think I'd just been snacking. So yeah, I think they caught this bug very, very early. I feel like I've also had an underlying flu or virus on top of it. I do think I'm going to pick up quite quick for simple reasons. One, it's a new medication the body's never had. Two, they've caught it at the right time. And three, my nutrition has been a little bit better, as in smoothies. There's a Lidl store in Manchester, and at the moment they've got cold press smoothies. So you've got the greens, which is avocado, spinach, and kiwi, which is very good to have in the morning, kiwi especially. And then they've got the mango and watermelon yellow cold press, and they're absolutely no brainer. I mean, you could make your own. But if it's local, why not? Health is wealth, as they say. So thank you anyway, guys. There's not much to really speak about, apart from my treatments changes in the medication. Everything stayed the same, as I'll be on every 3 months, and that's about it, to be honest. And I just hope that, you know, I get back to where I am very quickly, and I think I will this time around, because every cycle's different. You go into one cycle feeling very, very poorly, and you go into the next cycle just past that incubation stage, where you know that if you put it in a sample it might not show up yet. So we go through different stages, and that's primarily down to seasonal stress. That's also if the rescue antibiotics such as my clarithromycin are starting to slow down and not work as well. So yeah, but the reason they do it every 3 months is because over the years they've seen people be hospitalised every 3 to 4 months with chest infections such as mine. So to nip that in the bud, they do it at home here in Manchester, which is it's a luxury. I don't know how long it's going to last. I couldn't tell you that. The way the NHS is going, the way they're pushing to stop people's treatments, things like that, I don't know. But for the moment, it's one services should be proud of. Because I was speaking to one of my parents and saying if people moved away from round here, would they get this kind of treatment in Manchester? I don't think they would. I guess it's based everywhere in the UK, I'd like to think anyway. But yeah, it makes your life a little bit easier. So I'll show you what we're dealing with, guys, before I go. So we've got a needle, just for the new people, a needle that sits in a pot, which is a piece of plastic. We've got a little line there with a sterilised cap, and then it's got a clamp on it. So all they do, they come and see me, Dinky do, how you doing today? Take the cap off, give it a clean with a sterile wipe for about 30 seconds. Then they get a saline, which is like a fresh clean water, so flush the line, it'll go up the neck, down into the lungs near the heart. They'll pull back on the syringe, and what that will show the nurses is that this is actually functioning. It's bleeding back. They can draw blood, they can take bloods. The reason it wouldn't be working is if there was a jam, or there was some restriction inside the port, or the needle wasn't placed correctly. So what happens then is when they're trying to flush the port, they get a lot of pressure, or the patient, such as myself, may feel a sting, and the saline shouldn't sting. It should just feel like a cold substance, or sometimes you can taste it. So these are the things they do, but you've got to keep it very sterile. About a year ago, what they used to do, these caps weren't about, so they used to get like gauze and wrap it with gauze, but they found people who are at home were more risk as people in hospital, because even though they should be resting, sometimes they would do, you know, risky stuff. And when I mean risky stuff, I'm not on about hanky-panky. I'm just maybe a little bit going in the garden, messing about, going near the fish tank, etc. So this cap is securely shut, compressed. It's hard to get on, it's hard to get off. So that could be a lifesaver, because if you get an infection in this line, it could be very, very life-threatening, because it's linked to the arteries. And you can see, don't know if you can see it on the video, you've got a line that's actually not my neck, it's actually a line that goes up the neck, so that could spread everywhere in the and cause a huge infection. So it's okay. It's okay. It's better than midlines. It only stays in the chest, the needle, for 2 weeks. The port always stays in my chest. So having a foreign object in your body and being foreign at the same time, it's a little bit hard. I was joking. Right, guys, I'm going now. I'm going to try and watch some Mr. Bean. I'm going to watch me back, and then I'm going to go sleep. Right, guys, saluting you where you are. Stay fresh, stay sexy. If in doubt, send it out. Never live in doubt. In a bit. My peoples.